Hello dear students. So today the topic of discussion is our antiarrhythmic drugs. So let me start the antiarrhythmic drugs. Before we go to directly to the antiarrhythmic drugs, let me first tell you the rhythm of the heart. Then when you know the rhythm of the heart, then I'm going to tell you arrhythmia, what has happened to the in arrhythmic conditions, how it develops, and then it is very easy for you to treat the antiarrhythmic with the antiarrhythmic drugs. Antiarrhythmic with the drugs. Now, let me tell you first. You know that there are myocardium is divided into two myocardium cells is of two types. One is having the electrical activity, and another is having the mechanical activity. In other words, let me divide those cells as conducting cells. They conduct the impulses, conducting cells, and the other one is contractile cells. Okay? Contractile cells. These conducting cells set the pace. Say for example, here is your conducting cells. You know, conducting cells is having intrinsic ability to develop its own action potential, that is known as automaticity. That means conducting cell is having automaticity. Whereas these contractile cells are non-automaticity. They do not generate their own action potential, but they depend on the electric potential which is conducted by these conducting cells. Number one, that means generation of its own depolarization, that they are able to generate spontaneous depolarization. So there are 5 elements which are able to generate the spontaneous depolarization. That 5 elements are: number 1 is the SA node, number 2 is your AV node, 3rd is bundle of His, 4th is your bundle branches, and the 5th one is your Purkinje fibers. You know, SA node is considered as a natural pacemaker. Okay, and rest they are AV node, bundle of His, this bundle branch fiber. These are known as latent pacemakers. You know why SA node is the primary pacemaker? Because it reaches the threshold level very quickly. When SA node starts firing, the rest they don't fire at all. Now, when there is any change in the SA node firing, SA node action potential, when there is any kind of change here, then any of them will acting as a pacemaker to generate the beat. Okay. Now let me tell you here only the action potential of the difference between the action potential of conducting cell and the contractile cell. See here, this is a conducting cell. Let me tell you here a broader term. This is conducting cell. It may be your SA node, it may be your AV node or bundle of His. Okay. You know, I told you that there is no resting membrane potential for conducting cell. Why? Because of this entry of the sodium channel through funny sodium channels. There is continuous leaking of the channel. So that means there is always a phase 4. 4 phases there. It is all because of the entry of the sodium. In that indicated by phase 4. Number 2 is when there is entry of the sodium, it activates these L-type calcium channel to start the depolarization wave. So L-type calcium channel starts the 0 phase. This is the depolarization in which, what is depolarization? You know that is SA node generates the depolarization wave. This is your depolarization wave in the electrocardiogram. This is designated represented by P wave. So the P wave is generated. Okay, when the P wave is generated, what is going to happen? Then from SA node, when SA node generates the P wave, then it conducted, means it travels to this conduction cell, this is conducting of the impulse towards the AV node. And this is the conduction towards the AV node, means SA node generates, then the conduction travels towards the AV node. And when it reaches the AV node, there occur a dip of 0.1 second. What is that dip? Importance of the dip is that your auricles gets relaxed then. Okay, when it become relaxed, then AV node starts firing on the ventricles. So that means when signal went to the ventricles, then there occurs the depolarization of the ventricle, which is designated as QRS wave. This and the electrocardiogram, this is the ventricular systole. Okay, then what happened? There occur a plateau phase, then after that occurs the relaxation of the ventricles. This is designated as the T wave. Okay. Now, let me tell you here now the action potential. You know, I told you that 4 phase because of entry of the sodium channel, then 0 phase because of entry of the L-type calcium. Through L-type calcium channels, the calcium entry and results in the depolarization wave of the ventricle. Now, what is happening? There is occur phase third. When in phase third, there is opening of the potassium channels and potassium channels goes out. Look, this beat occurs at a normal rhythm. Normal velocity is having this beat. That means next beat will generate at the same interval. Then again P wave, QRS, then S wave. So it all occurs in a rhythmic manner. This one wave, this is second wave. Similarly, these are all rhythmic. Normally your SA node produces around 60 to 80 to 100 beats per minute. This is the SA node generated these beats per minute normally. Okay, so the action potential of SA node is like this way. Okay, now coming to the action potential of the contractile cell. You know the action potential of the contractile cells. The resting membrane potential is here minus 90 millivolt. Okay, and there is true resting membrane potential because of this. This is the resting membrane potential, phase 4. This phase 4 is because of this opening of the leaky potassium channel. These potassium channels are known as inward rectifiers, potassium channels. And because of the leaky of the potassium channel, this phase 4 occurs. And when the stimulus reaches from the neighboring cell to the contractile cell, then sodium channel opens and rush of sodium gets entry inside the cell, increasing the positive. There is phase 0. This is the depolarization phase. That is the depolarization spread towards in all the ventricle. Now this is 0 phase. Okay, it is because of entry of the sodium channel. Okay, now when it reaches to the plus 40, another channel opens. That channel is potassium channel for a brief period. For a period of when it reaches back to the 0 millivolt, then at 0 millivolt your calcium channel gets also open. So that means at same place as phase 2, your calcium is getting entry, potassium is leaking out. So there occurs a 2 phase, that is there is no gain of the charge or losing of the charge. So there occurs the plateau phase, and this plateau phase is because of entry of the calcium channels. Okay, now and lastly, when your ventricle relaxes, your potassium channels open, and this results in the repolarization towards the and again the phase 4. So this is normal rhythm. Rhythmic heart. How it works? I already told you the mechanism of action, molecular mechanism of action in my that previous class, congestive heart failure part first, where I where I told you regarding the molecular mechanism of the action potential of the conducting cells and contractile cells. Okay. Now this is the rhythm. This is your rhythm.